Hello, I am so glad to be with you again. We are excited about the efforts and the devotion that you have shown in establishing the first annual Congress of Lifestyle Medicine sponsored by the Romanian Society for Lifestyle Medicine. I am excited to be with you, and I'm very, very delighted that I was asked by your president to perhaps keynote the concepts of diet and disease. Is there a relationship? The key question that was given to me was fork and knife complicit in the cause and cure of chronic diseases? Is there a relationship between diet and chronic disease? What is the relationship? And we began to understand that chronic disease cannot be cured with pills and procedures. That's why we have the lifestyle medicine specialty now emerging, because today's modern killer diseases, common chronic disease like heart disease and diabetes and obesity and hypertension, cannot be cured with pills and procedures. That's the very nature of chronic disease. It lasts forever. You have heart disease and you have medications, you have procedures, you have bypasses, you have stent, and the disease continues, and you're going to die with heart disease because we have no cure, medically speaking, for it. But it becomes more and more clear that chronic diseases can be cured. And maybe you ask the question, how? Because you are not yet familiar with the lifestyle medicine concepts. How do you cure chronic diseases? How do you cure heart disease and hypertension? And how do you cure arthritis and diabetes type 2? You do it with an enlightened, intelligent lifestyle and self-care that will activate the body's innate ability to begin to heal itself. This prominently involves a simple, more traditional diet of foods as grown. So my presentation today is Fork and Knife, Instruments of Hope, Health, and Healing. But let us review the presentation that I made initially, where we talked about fork and knife, weapons of mass destruction, looking at the role that diet plays in the etiology of these chronic diseases. And I want to do a quick review, and we begin to recognize that these chronic diseases have emerged and have blossomed in the last 30, 40, 50, 70 years. For instance, with heart disease, here you take a look at 1928. This is after World War I. Dr. William Osler reports that heart disease was so rare that maybe you could find one heart attack a year in an average town. Today, we are talking about 3,000 heart attacks a day, and cardiovascular disease is the #1 cause of death in our society. And then we looked at the changes in the chairs. And remember, from 1900 to 1970, the average size chair in America had 43 centimeters, 43 centimeters, 45 centimeters. It didn't change very much in 70 years. And then suddenly now it is 61 centimeters. America has emerged larger than ever, so that 74% of the adult population is either overweight or obese. And with obesity, you have to worry about diabetes, which has been climbing beyond our expectations, doubling every 10 years in America. And then you have to worry about high blood pressure, heart disease, arthritis, asthma, sleep apnea, and certain adult cancers, which are all promoted and fueled by excessive overweight, obesity. And you take a look at, for instance, here at breast cancer. In 1960, 1 in 20 women in a lifetime could expect to develop breast cancer. Today, it's 1 in 7. And the question is, with all the advances in medical technology, we can do things we would have never dreamed of years ago. why do we have such an increase in most of these chronic diseases? And some people have suggested that maybe it has to do with our change in diet. And here you remember the chart that we showed you, how with the increase in the income in a society with affluence, the changes in diet are very acute. You go from foods as grown and you refine them, you strip them of their nutrients, and you enhance their flavor for taste buds that are probably becoming adulterated by excessive amount of salt, sugar, and fat. And then you come up with the right-hand column there, where you see the American diet, which consists mostly of the colors in red, mostly of fat, and then sugar, and starch is usually white flour starch, and excessive amount of protein, especially animal protein. This is a typical American diet. To break this down, we talked about two major dietary shifts. The first one was going from whole foods to industrialized products, from slow foods to fast foods, from eating at home to eating out. And we increased dramatically the number of empty calories, empty meaning devoid of nutritional value. And we reviewed the data that suggests that 44% in America of the calories eaten come from empty calories, refined empty calories. And then we looked at a second dietary shift, and that was the increase in meat consumption, especially in processed meats, the fast foods, and the relationship to certain cancers. We talked about the role of cheese as the #1 source of saturated fat in the diet, contributing to high blood cholesterol levels. And here you see the dramatic increase in the consumption of meat from 56 kilograms to 91 kilograms over a period of 100 years. That's per person per year. And so this is then the American diet that everybody wants and is clamoring for, where 55% of the calories come from refined processed foods, 31% comes from dairy and animal foods, and only, this is the point I want to make, only 14% of the calories that we eat in America today, only 14% come from fruits, vegetables, whole grains, not white flour, but whole grains, legumes like beans and lentils, and some nuts. These are the foods that come out of the hand of a master designer. These are foods as they come in nature to us. But that's all we eat. Only 14% of the calories we consume today come out of foods as they come to us in nature. And so it shouldn't really surprise us when Dr. Walter Willett from Harvard University says epidemiologists, people who study the epidemic of these diseases, have long known that the major determinants of our killer disease are dietary and lifestyle factors. We talked about the heart, we talked about the coronary artery sitting on top of the heart muscle and what's happening inside in the artery. We talked about the cross-section of the artery. Here you see the coronary arteries in cross-section. We are devoid, we are without any encumbrances on the inside of the coronary artery at birth, but after 30, 40, 45 years, we can expect 60% narrowing of these coronary arteries. And we said that there are no symptoms. The first sign of heart disease, actually, for 40% of the people, is sudden death. We need to recognize that this disease called atherosclerosis, the underlying pathology, is not only affecting the coronary arteries, but all the major arteries from the top of the head all the way down to the feet. These are many diseases in many different locations with many different names, treated by many different specialists, but there's one underlying pathology, and that is atherosclerosis, which then expresses itself in the area of the coronary arteries as myocardial infarction or angina pectoris, in the brain arteries as a stroke, senility, memory loss, hearing loss, visual loss, all of these are related, and then hypertension affecting, obviously, related to the kidney arteries, then you have gangrene, impotence, the penile arteries, small as they are, but they become narrowed down with this plaque buildup, where you have cholesterol buildup and fats and calcium. And as the opening in the penile arteries begins to narrow down, ultimately, obviously, the optimal blood flow can no longer be sustained, and there's embarrassment. And this is happening to probably 60% of people over 45 years of age in America. Claudication and then degenerative disc disease. And so then we ask the question, well, what are the antecedents? What are the predictors? What drives this disease called atherosclerosis and in its inflammatory aspects? And we began to look at these risk factors. We looked at the risk arch, and we said the higher they are on the arch, the more powerful they are in driving this disease. And the number one is cholesterol, then high blood pressure and smoking. And then you look at diabetes, obesity, and triglycerides, and of course, inactivity, stress, and perhaps genetics sometimes can play a role too, although epigenetics will overrule this nowadays. And so we began to realize that these risk factors, these determinants of atherosclerosis and our most common diseases relate to 3 F's. The first one is the fork, the diet, as you see here, the yellow stars. The second one is the fingers, that's smoking. And the third F is the feet, exercise. So these are 3 major dietary habits that can spell disease or health. How do we use them? That's the question. Now, Dr. William Connor is a pioneer in the area of atherogenesis in animals. And he said, if you want to produce atherosclerosis, you want to produce a heart attack in monkeys, for instance, all you have to do is feed them a lot of cholesterol and saturated fat. And he said, if ever a human disease can be produced in animals, it's atherosclerosis. Again, it just takes cholesterol and saturated fat. And we looked at the Harvard studies that suggested that 70% of stroke is preventable, 71% of cancer, 82% of heart disease, and 91% of type 2 diabetes totally preventable if we could make some dietary changes. And the experts estimated that about 80% of chronic disease in America could be prevented by making significant changes in diet and exercise. And then there was this wonderful giant man that is the father of the whole fiber concept, and also he is the man that found the answer to a special cancer in African children when he was a missionary physician there, and this is the Burkitt lymphoma. He said, when he was honored in front of 600 physicians who came to applaud him for receiving the equivalent of the American Nobel Prize in Philadelphia in 1992, they heard him say, the greatest medical discovery in the last 20 years, that's from 1970 to 1990, was the understanding that our modern killer diseases are largely lifestyle related, and therefore they must be preventable and potentially reversible. So let's talk about reversing chronic disease. And my topic today is instruments of hope, health, and healing. Fork and knife, instruments of hope, health, and healing. And we're going to take a look at what happened to President Clinton in 2004 at the age of 59. He underwent quadruple coronary bypass surgery because he had chest pains. And 6 years later, in 2010, with recurring chest pain, the pain came back. He underwent a double stenting to keep the restenosing artery open.
I was lucky I didn't die of a heart attack.
Former President Clinton, like too many people, was busy. And for years, he ignored warning signs from his heart. But in 2004, during an exhausting book tour, there was something different.
I had a real tightness in my chest when I was getting off the airplane, and it was the only time I'd had it unrelated to exercise.
We're here outside New York Presbyterian Hospital. In just a couple of hours, President Bill Clinton, former president, is scheduled to undergo surgery.
So I immediately went down to our local hospital, and they did a test. They said, "You got real problems." They hustled me down to Columbia Presbyterian, and they confirmed the determination that I had serious blockage and needed the surgeries.
The doctors immediately knew options were limited. The 58-year-old Clinton needed to have his chest opened, his heart stopped, and surgery performed.
There's no medical treatment for reversing the obstructions that have already formed in his blood vessels.
I got Hillary and Chelsea there, and all I remember is it was happening fast, and everybody who cared about me was scared, and I felt rather serene. I thought, gosh, we dodged a bullet. I didn't have a heart attack.
On Labor Day in 2004, Mr. Clinton had 4 blood vessels bypassed.
Starting this morning around 8 o'clock, he had a relatively routine quadruple bypass operation. We left the operating room around noon, and he is recovering normally at this point. So I think right now everything looks straightforward.
Another life saved, right? Really? Do we have a cure for heart disease? Is this a cure for heart disease? And then, since many people knew Clinton as being a lover of fast foods, I mean, he was not a paragon of dietary purity, really, when it comes to healthy eating. They wanted to protect his good reputation, and the cardiologist at New York Presbyterian Hospital made the statement, this was not the result. I mean, this stenting was not the result of his lifestyle or his diet. No. What we have to remember is that heart disease is a chronic condition. We don't have a cure for this condition, but we have excellent treatments. Yeah, take a look. Medical technology provides indeed many successful outcomes for acute and episodic disease that come and go. We are unexcelled in diagnostics and in emergency care. And for chronic diseases, we have many treatments, but cures are rare and very elusive. Take bypass surgery. We do 400,000 this year again. Average cost is 140,000 euros per surgery. And yet, when you look at the bottom listing there, within 12 to 18 months, about 40% of these grafted vessels are no longer functioning. We're talking about a 38 to 46% graft failure. The graft has become affected by atherosclerotic plaques because apparently very few, if anyone, is really telling these people from now on, you have given a second chance. You have to really take advantage of that. You've got to really stop smoking. You have to get into an exercise program, and you have to really follow a diet that's whole food, plant-based. You have to limit cholesterol intake. You have to limit fats if you want to really keep those grafted vessels open or prevent the other coronary arteries from clogging up. And so we know that the best and most even-handed estimates are that only about 10% of heart attack patients have their life extended after bypass surgery. And that's why Newsweek had a special feature there. I mean, I saw this. I saw these surgical knives there pointing to the chest of this patient. And I wondered, why are they bad-mouthing bypass surgery now? What's going on? And then next to it was the writing, one word that will save your life. And I thought, what would that one word be? And then I discovered in this major article on the inside that this one word consisted of 2 letters. What do you think that was? 2 letters, one word that will save your life, and the letters were N-O. They talked about the limitations of bypass surgery that's probably overdone, that probably 80% of these bypass surgeries could be avoided, could be replaced, could be taken care of in a different way through a lifestyle medicine approach. Yes, and I want to talk to you about that today. as I talk about Dr. Ornish and Dr. Esselstyn, who have reversed, documented scientifically that these plaques begin to melt down and regress again, oftentimes within less than a year. And then we have angioplasties and stents. And again, here in the US, we have about 1 million of these stents a year, and the average cost is about 30,000 euros if everything goes well. And yet, somebody said stents are like Pringles, like potato chips. Really? Yeah, stents are like potato chips. You never just take one. I have had one patient that had 25 consecutive stents because these stents don't last. And so then after the double stenting, the chief of cardiology came to President Carr. And let me do this again. And then after the double stenting, the chief of cardiology commented on Clinton's case. And he said, really, essentially, a stent is just a tune-up. We see people like this who come to us every 4 to 5 years. That's a very optimistic time frame. Much of the data actually suggests that they don't last that long. As a matter of fact, they only last that long if you really make some lifestyle changes. Now, what about statin drugs, the most profitable drugs in the history of medicine, with over 1 trillion euros being sold last year? Well, here you see that when these statin drugs are used to reduce cholesterol after a heart attack, they can actually help in reducing the all-cause mortality by about 10 to 20%. On the other hand, most of these statin drugs are not prescribed for secondary prevention, but they're prescribed for primary prevention. And here, the benefits, if there are any, are very, very small. A major meta-analysis of 11 randomized controlled trials with over 65,000 participants, they showed that the statin drugs indeed dropped the LDL cholesterol by about, well, in this case, it was about 40 points from 139 to 98. And you say, well, that's great. If cholesterol is that important, obviously these drugs have their purpose. But then comes the second line, but no evidence was found for any benefits of statin drugs on all-cause mortality. It didn't affect the heart, really. It didn't affect the longevity of a person in this high-risk primary prevention setting where they followed these people for 4 years. And here's an editorial in the Journal of the American Medical Association by the editor, and she said, we have underestimated the risk of statin drugs approaching 20% of patients at risk for muscle aches and pains, and at risk for developing diabetes and memory loss. And then she said, if we give 100 men who never had a heart attack before, if we give these 100 men these statin drugs for 5 years, we might expect to prevent how many? 1 to 2 heart attacks. I mean, imagine you take 100 men at risk for a heart attack, and you give them the statin drugs, you lower their cholesterol by 20, 30%. You give them the drugs for 5 years, you spend 500,000 euros on those drugs on those 5 years. And what you get out is maybe a benefit of preventing 1, or at the most 2 heart attacks. And then she asks the rhetorical question, well, what shall we do? Well, she said, a healthy lifestyle, a simple diet, and daily exercise. Well, we could talk about medications that are used for lowering blood sugar or for high blood pressure. And again, these medications don't cure, they manage at best. There are always side effects. Here's, for instance, the Accord study dealing with diabetics. They provided maximum optimal medication dose to really seeing the effect of changing the disease progression of diabetes. And what they found is there was an increased death from heart disease, and prematurely so. So the more drugs The better the outcome? No. The more dangerous, the more harm you might encounter. And the same thing with these high blood pressure medications. They're very costly. There's no effect in preventing a heart disease event. Well, they may be helping in terms of preventing and slowing down and delaying a stroke, but there are always complications that you have to be concerned about. One of them obviously can be impotence and decreased libido. Here's the classic scenario. The doctor told me I would probably be taking blood pressure pills for the rest of my life. Yeah, and probably not just one, but 2 and 3 and 4 blood pressure medications. And then you have to take another 2, 3, 4 for the side effects of these medications. And so the idea that for every ill there's a pill, that's a dream that has not been fulfilled when it comes to chronic diseases. We can do this successfully with infectious diseases. So we thought until COVID came around. And so we can stop an infection in 10 days with antibiotics. And so people have the idea, well, if you have some chronic disease, we have the same we have the same expectations, but tragically, so that is not usually the case. Here's an article in the New England Journal of Medicine. They write, cultural expectations of immediate, simplistic solution have been bolstered by consumerism and advertisement and fully exploited to generate demand for therapies that are, in quotes, in parentheses, often, parentheses closed, marginally indicated and potentially unsafe. Have we perhaps oversold the idea that for every ill there's a pill? Take a look. This is data here that came out not too long ago, which shows that prescription drugs are the #3 cause of death in America, responsible for 11% of all American deaths. And you've seen this chart before. #1 cause of death is heart disease and stroke. #2, cancers, and #3 cause of death in America, 11% prescription drugs. Either the drugs were not taken properly or they did not anticipate the complications that were taking place with other medications, or they were just not properly prescribed. And so this is then the picture. What do you see there? Tell me, what do you see? Well, you see people on the ground in green uniforms, and they all have mops in their hands, and there's water on the floor, and they're trying to keep the floor dry. They're very devoted to their art. They forget to take care of their families. They're just devoted to one thing: keep the floor dry. They even pass out umbrellas to people that are there too, so as to keep them dry. And what's the problem? What's the real problem? Are they just treating the symptoms? What's wrong with this picture? We need to go upstream. We need to prevent some of these things. We need to cure the problem. And here you see the cause. The cause is a leaking pipe. What you need is not a team of doctors and nurses. What you need here is you need to have a plumber to come in and take care of the leaking pipes. And you know, when we take care of the symptoms mostly, please take a look. We spend now 86% of our medical national budget in America on managing chronic disease symptoms. We're no longer curing, we're merely managing chronic disease symptoms, because these chronic diseases are largely related to our habits. These are the causes, and they cannot be cured by some mechanical device or by some medication. Here you see 1960, about 5% of our income as a society was spent on medical care. Then you go to the very right-hand side, and you see that in 2020, some 20% of our income is being spent on managing chronic disease symptoms to a large extent. And the chronic diseases are not becoming less, but actually they increase because our lifestyle, our culture is promoting a lifestyle that is aversive to health. But can you really reverse these diseases? Here you have the first indication, World War II, Nazi armies invade Norway, occupy the country, take all the livestock to feed their soldiers. And what happens to the people's health? With all the war fear, with all the anxiety, with all the stress, you would expect an increase in heart disease, wouldn't you? Not so. When you have a very simple diet, stress is not really a big factor, as is shown here in World War II in Norway and in many other countries in Europe. Please note, when the war is over in 1944, 1945, guess what happens? People go back to their pre-war diet and the diseases come back. Now, when you look at animals, we know we can create heart disease by feeding them a diet high in cholesterol and saturated fat. But here's Dr. William Castelli, the former director of the famous Framingham Heart Study. He said, if you want to reverse coronary artery disease in these monkeys, all you have to do is feed them a simple, low-fat, natural, whole food diet. What is he saying? Foods as grown, plant-based, whole food. And people say, well, yeah, okay, so this is for monkeys. But what about humans? Any studies there? Yes, there are. Here's Dr. Dean Ornish, a prominent cardiologist that has, for the last 40, 50 years, raised many eyebrows in breakthrough therapies. 1990, big time, he published in the Lancet Medical Journal the article where he took 48 heart disease patients, randomly assigned them to intensive care, where he gave them a very simple diet, very low in fat, exercised them, no smoking and stress management. That's for half of the group. The other group was sent to their physicians to have the usual care, and they were prescribed under those auspices the American Heart Association diet for heart disease, which would allow 30% fat and cholesterol-containing foods. And so, and after 1 year, Dr. Ornish did the PET scans, what shall we say, the x-rays of the arteries, and he found, number one, the plaque, the inside buildup in the coronary arteries had regressed, had begun to melt down in 82 of the cases, while the plaque in those patients were on the in the red box there in the on the American Heart Association diet. They actually had a progression. 53% of the people had a progression in their plaque buildup in the arteries. Please also note, when it comes to cholesterol changes, the intensive care group lowered their cholesterol by 24%. Nicely done. We can do this in 30 days, actually. And the usual care, the American Heart Association only brought the cholesterol down by about 5%. Here you see what we do in the CHIP program, the Complete Health Improvement Program, where we instruct people in a 30, 40-hour educational program that meets over a period of 4 to 10, 12 weeks. We help them to make lifestyle changes in groups of 10, 20. I had sometimes 500 people, 1,000 people in my classes. And here you see the cholesterol results in people that had cholesterol levels of over 280. There were 126 people, and their cholesterol drops were 20%. Here's a summary on the work of Dean Ornish when it comes to heart disease. It says he has scientifically proven that people can open their blocked arteries without drugs or surgery. He guides them through a rigorous lifestyle program where the key issue is a very simple diet based and focused on whole foods, plant-based. And then you have Dr. Esselstyn. He started his experiment around the same time that Dr. Ornish began his. In 1985, he's a famous Cleveland Clinic surgeon. He was considered to be one of the top 10 thyroid surgeons in the country when he changed his emphasis in his practice, became involved in educating people of how to reverse coronary artery disease. Single-handedly, he used a whole food, plant-based diet, very low in fat, in helping people with heart disease, coronary patients who had been kind of described as the walking dead. Last station before it was over, right? Surprise. Let's take a look. So he had initially 24 patients enrolled in his study. 18 patients continued with him. 18 coronary patients were treated at the Department of Cardiology at the Cleveland Clinic over a period of 8 years. Their cholesterol was 6.0 millimoles per liter, which is about 238 milligrams per deciliter. And over those 8 years, those patients seen by the best and finest cardiologists in the country, nevertheless had 49 cardiovascular events, 9 angiograms, bypasses, and 7 heart attacks or strokes. And the disease actually had progressed. So you have here now 18 coronary patients treated at the famous Cleveland Clinic by the best doctors with the best medical approaches that we have. And in 8 years, it actually didn't stop and hinder 49 cardiovascular events to take place. Then they come to Dr. Esselstyn and they said, look, we don't know what to do. We have had all the surgeries, we had all the medications. There's nothing the surgical colleagues can do for us anymore. Can you help us with your dietary program? And he put them into this his program called the ART program. Over the next 5 years, the cholesterol levels dropped to 3.5 millimoles per liter, which is the same as about 145 milligrams per deciliter. And in those next 5 years, even though these patients are now older, they should have had more heart disease, more clinical events, 0 cardiovascular events, and another 7 years later, this is now 12 years altogether, the cholesterol is still being kept at 3.6. That's under the 150 milligrams per deciliter mark, which is apparently providing us with coronary safety. And look, over the next 7 years, 0 cardiovascular disease. I want you to really think about this. 8 years under the treatment of some of the best cardiologists with the best medical care, 49 cardiovascular events. Then the people age now, and 12 years later, when they should have had many, many more cardiovascular events, 0, 0, 0, 0, and regression of coronary artery disease. So 18 patients stayed on his program over 12 years, no cardiovascular events, but 6 who had dropped out in those 12 years. These patients actually had 13 cardiovascular events. The way you live is the way you die, isn't it? And here's some of the documentation. These are special angiograms. You see the coronary artery there. You see the circle on the left side. This is a coronary artery that was severely narrowed down. There was very little blood flow through the coronary artery on the left. On the right-hand side, this is now 2.5 years later. The same artery, same patient, of course, same area, x-rayed, and you see full opening again, and optimal blood flow, obviously no more angina pain. Angina pain usually diminishes within weeks when you are following a program that uses a very low-fat, plant-based diet, because your blood the blood viscosity begins to become lowered. The blood becomes kind of thinner. It becomes more aqueous, and so it can get much easier through these narrowed arteries. The actual narrowing process does not diminish within 4 weeks or 8 weeks. That usually takes at least a year or more. Here's Dr. Esselstyn, and he said, stents and bypasses have their place in emergency settings. However, elective application, when you do a bypass that may not really be under emergency situations, that can perhaps wait, they don't prolong life, and they do not protect a patient from a heart attack. In contrast, he said, a plant-based nutrition program which treats disease causation. We're no longer talking about symptom management. No, we're talking about causational aspects. When we treat disease causation, then we can arrest and reverse cardiovascular illness and stop the epidemic.
All right, so can you cure heart disease just with food. The question might seem strange, but our Dr. Sanjay Gupta has living proof of it. It is part of his fantastic special report called The Last Heart Attack, which you can see this weekend on CNN. Sanjay joins us live from Atlanta now. Sanjay, you spent the last year looking into heart attack and heart disease for your special. You have a history of it in your family, and you've really studied how people can get away from that and get out from under that. What if you don't want to use medicine, statins, to reduce your risk of heart attack? Can you really use food as medicine?
Well, you know, it's interesting, Ali. Hippocrates has talked about this for more than 1,000 years, and I walked into this with an open mind, but the answer is definitely yes, you can. And we did find living proof of this. Sharon Kintz is a woman that we profiled, 66 years old, had a heart attack, was told by her doctor she needed to have heart surgery, and she said no. And she basically adopted this plant-based diet. As you can see there, she's been very strict about it. You know, whole grains, lots of vegetables. Been doing it for over a year, and it's quite remarkable. Not only in how much she has not had any symptoms of heart problems, but also in terms of her energy levels. And this is something that I, really focused on with her. She could barely walk before all of this. And literally now, a year later on this plant-based diet, she's able to jump rope. I mean, take a look at that, Ali. She couldn't do that before. And I'm not saying that obviously being on a plant-based diet taught her how to jump rope, but people always question, do you have enough energy still on one of these diets?
Right.
And we profiled her just to demonstrate.
All right, so it's a pretty serious diet. It's a pretty extreme way to go. Is there science that proves it's working other than the fact that she can jump rope and she's fit?
Well, yes, there's a couple of different things. First of all, people really oftentimes want objective signs to show that there's changes in someone's blood vessels. And we talked about this before, Ali, not just in terms of showing a slowing of heart disease, but an actual reversing of heart disease. In order to prove that, a patient would have to undergo another angiogram. Sharon's doing so well, she said she had no need to undergo an angiogram. But let me show you a patient who did do that. And this is over a period of a few years. Take a look over here, and I don't know if you can appreciate this, where the arrow is. This is a coronary blood vessel, and this is what one of those narrowings looks like. This is what a heart attack waiting to happen looks like. This is someone who decided not to undergo surgery, which was recommended, instead using food as medicine. And take a look now over here, same spot, and that coronary blood vessel is essentially, it's opened up. It's about the same normal caliber as the rest of the blood vessel. That is sort of what we're talking about here, Ali, in terms of providing some sort of objective evidence. Remarkably, despite the fact that, again, Hippocrates has talked about this for over 1,000 years, this is still a relatively nascent science. I think more studies are going to be done. You can see more images like that.
And we've talked a couple times this week. We'll talk again about the different ways. I mean, you're not advocating just one way to prevent a heart attack, but the special is called The Last Heart Attack. So these patients that have been profiled who have followed these diets to reduce their clogging of their arteries, have they prevented heart attacks?
Well, let me tell you, yes. And let me tell you the study that basically pivoted me into saying we should do this as a full hour. It's still a relatively small study because this is some emerging science, but Dr. Caldwell Esselstyn, basically he followed patients for 12 years, and what he found was that 6 patients out of a group of about 18 dropped out of the study, and out of those 6 patients, they all had some sort of coronary event. 2 patients died, 4 patients needed bypass surgery. Of the patients who stayed through, kept the diet, kept it going for 12 years, so most patients were able to do that. Only 1 patient died, and on autopsy, that patient did not have any evidence of heart disease. So again, Ali, the evidence is pretty compelling, not only in terms of slowing down the progression, but really reversing it. These patients needed to have heart surgery, and then they essentially needed no interventions whatsoever over a 12-year period.
That is incredible that you can undo that damage, possibly. All right, Sanjay, thanks again for joining us to tell us about the special.
And now let us go to the halls of power in Washington.
How did you lose so much weight? What kind of diet are you on?
Well, the short answer is I went on essentially a plant-based diet. I live on beans, legumes, vegetables, fruit, no dairy, and it changed my whole metabolism, and I lost 24 pounds, and I got back to basically what I weighed in high school. But I did it for a different reason. I mean, I wanted to lose a little weight, but I never dreamed this would happen. I did it because after I had this stent put in, I realized that even though it happens quite often that after you have bypasses, you lose the veins because they're thinner and weaker than arteries. The truth is that it clogged up, which means that the cholesterol was still causing buildup in my vein that was part of my bypass. And thank God I could take the stents. I don't want it to happen again. So I did all this research, and I saw that 82% of the people since 1986 who have gone on a plant-based, no dairy, no meat of any kind, no chicken, turkey, if you can do it, 82% of the people who've done that have begun to heal themselves. Their arterial blockage cleans up. The calcium deposit around their heart breaks up. This movement has been led by a doctor named Caldwell Esselstyn at the Cleveland Clinic, Dean Ornish in Minoa in California, the doctors Campbell, father and son, who wrote the China study, and a handful of others. But we now have 25 years of evidence. And so I thought, well, since I need to lose a little weight for Chelsea's wedding, I'll become part of this experiment. I'll see if I can be one of those that can have a self-clearing mechanism. We'll see.
And look what happened. A president that has adopted a new lifestyle where food becomes the new medicine. This is the new entertainment style of Bill Clinton since he saw the film Forks Over Knives, which means that the fork may be more important when it comes to heart disease than the knife of the surgeon. Well, we can talk about diabetes too. We can reverse this. This is really not that difficult to do once you make some lifestyle changes. 1955, here's one of the studies, one of many, many studies, 80 diabetics on insulin. He gave them a very low-fat diet of natural whole foods. And within 6 weeks, 50 out of 80 diabetics on insulin were free of insulin. They were no longer diabetics. As long as they followed the program, there was no concern about high blood sugar levels. And the same is true in our CHIP program. Here you see 40% of the diabetics that we have in our program within 30 days are no longer diabetics in that their blood sugars come down to normal. And Dr. Professor James Anderson, who has written over 500 books, articles, and chapters in books, he said some 50 to 75% of type 2 diabetics on insulin and 80 to 90% of those on pills could normalize their blood sugars and be off medication within weeks if they change their diets. And the same thing is true for high blood pressure. Here's a 30-day program where people are following a very simple dietary program. 55% of these high blood pressure patients on medications are no longer on medication, and their blood pressure levels are normal. The same thing in our CHIP program. 67% of those patients and clients in the very high diastolic blood pressure range at baseline were no longer in that range within 30 days. Within 30 days, blood pressures had normalized themselves and they had to be taken off their medications.
My name's Joe Monaco, and prior to the CHIP program, my life was basically starting to spiral down with one kidney. Lost my kidney 20 years ago. I've had diabetes for over 10 years. I really owe this CHIP program for turning my life around.
Around the world, there is a pandemic issue. Lifestyle diseases are taking over.
When we look at the disease burden in the United States and more around the world, what we see is that it's chronic disease. It's these non-communicable diseases that stay with people for weeks, months, years, even decades.
Being a medical doctor, knowing a lot about medication and drugs, I'm not against conventional medicine. I really feel it has its role, but we know that when it comes to lifestyle, conventional medicine doesn't do very well because we treat the results, we're not actually managing the cause. And this is where CHIP is so incredibly powerful.
My husband joined the group, which surprised me because he's been a butcher all his life. He actually lost 10 kilos in the first 4 weeks.
What a joy to see someone respond in a way that our medication can't fix.
CHIP can be the connection for people that don't believe that they can do better to become whole person health warriors. And I think that's what CHIP is all about.
These are things that I want for my patients, and to be able to do that with this natural, holistic approach rather than prescribing a pill, to me, it's the best thing in the world.
The transformation of lives that I witness, I mean, this is priceless. There's nothing that could buy that.
I think we've realized when we look at health and wellness that there's the mental aspect and the spiritual aspect. And if you don't address those issues, often people don't really get as well or improve as much as they should. And that's been the joy of running a CHIP program that is so balanced the way CHIP is presented.
My world is better.
What a joy to see people's lives turning around. And so here are some of the recommendations for your consideration. We need a new cow, high in fiber, no cholesterol, lots of nutrition. It's there. Then we need to take a look at the Harvard recommended dietary patterns. You see lots of green vegetables, vegetables in general. 20% of the calories should be from fruits, 25% from whole grains, and then 30% from healthy proteins, some animal products perhaps, but also to really don't overlook the beans and all the foods that are carrying plant-based protein. And here's the Physicians Committee for Responsible Medicine, Dr. Neil Barnard. They're recommending fruits, vegetables, legumes, and whole grains. Same kind of idea to reverse and prevent disease. And in actual numbers, it looks like this. When you contrast the American diet and the optimal diet, the CHIP program, and you see the fats and oils, you have really cut back from about 100 grams on the average down to about 40 grams, really cutting back on fats and oils. Cholesterol from 400 milligrams to less than 50 milligrams, which means if you are a total vegetarian, you will have zero cholesterol. So we open the door a little bit for some animal products if people insist they want those. And then when it comes to sugar consumption, cut back on 35 teaspoons a day down to less than 10 teaspoons, salt from 10 grams, which is a lot of salt, down to less than 5 grams. The body actually only requires about less than 1 gram of salt a day, but we're taking in 10 times the amount. And so then when it comes to fiber, we have a measly amount of 10 grams of fiber. We probably should have more like 35 to 60 grams of fiber. And with that, you would alleviate a lot of problems of the intestinal system, and you would also strengthen the immune system. And when it comes to water, you know, most of us don't drink any water or not enough, and we should really push that quite a bit. And this means then a more optimal diet where we focus on a wide variety of whole foods, foods that we can eat as much as we want as they're grown without all the fats and oils and sugars and salt, and where we try to keep refined processed foods at a minimum. And if you really want to eat animal products, we recommend use them only as a seasoning or as a condiment. This then is sort of the kind of diet that we recommend: fresh fruits, vegetables, whole grains, legumes, and lots of water to drink. Couple that with exercise, stress management, and obviously no tobacco, and you have a prescription for a longer and happier and healthier life. Now, in case you think, I cannot really make this big jump all at once, I understand. Here on the left-hand side, you have the typical American diet: meats, dairy, eggs, processed foods, alcohol, and caffeine. And of course, you also here have the worst health outcomes on the top there. These are the American Western diseases, the chronic diseases. But then as you move towards the right-hand side, you begin to eat less and less of these foods in the red triangle, and you begin to eat more fruits, and you begin to eat more foods in the green triangle, where you emphasize fruits and vegetables, whole grains, lots of beans and legumes, and some nuts and seeds, and plenty of water. So Eating plant-based then is about widening our circle of compassion and avoiding unnecessary pain, suffering, and death. We're not thinking of our friends or animals. And here's some well-intended suggestion from our feathered friends. Eat more kale. And then to finish it up, here's Dean Ornish. What's good for you and your health is also good for our planet. And it's good for the animals. They will thank you for it. Although heart disease and diabetes kills more people each year worldwide than all other diseases combined, these diseases are completely preventable and even reversible for at least 90% of the people today if they changed their diet and lifestyle. So we have a choice. Moving towards a plant-based whole food diet seems to me to be a very responsible and enlightened choice on a planet that is fighting for its survival. Fork and knife. Either these are weapons of mass destruction, or they can become instruments of hope, health, and healing. What are you putting at the end of your fork? Blessings on you and good health.